You're welcome, my audience and my viewers. I shall continue on food therapy, the importance of food therapy in our daily life. Food therapy is a new world order. Yes, having great awareness about it will afford and encourage us to start slowing down on complete dependence on drug therapy, which has high adverse effects as compared to usage of food for treatment. I shall be talking on coconut water. Using coconut water as treatment. Coconut water may be regarded as a mere and well-sweetened water to everybody or to some persons, because many do not know the therapeutic ability of coconut water, so they undermine it. Some just, break coconut, eat the fruit. Even the fruit is highly therapeutic, but I shall be talking on the water today. Yes, I want everybody to pay attention, because coconut water is one of the most potent foods known. Yes, coconut water, as it is an antiviral agent. And you know that most viruses inside the body are not curable. But most bacteria are curable, and most parasites and other microbes, like Rickettsia, chlamydia, a lot of them are treatable. But most viruses are not treatable, and they are plagues disturbing mankind. Yes. Well, I would like to focus on the antidote nature of coconut water. Coconut water can be used to neutralize snake poison. Yes, but the usage of coconut water, the usage of coconut water for treatment of snake bite must be carried out with medical experts. Yes, with medical experts. While medical experts, we have to carry out such basic treatment is that one, we have to, use coconut water as drip. Coconut water is a natural drip, and we need a medical expert to set the line, to set the drip. Yes, so ordinary persons cannot set line with coconut water when it comes to snake bite. You see, snake venom, what it does is to clot the blood in the system. The blood that is in fluid state, that is pumped by heart, will stick and become clotted. That is the effect of venoms of snake bite. Yes, that is the effect of venom of snake bite. And as such, we will need a fast treatment, a drug that will be well and fastly distributed within the blood system to neutralize such action of snake venom. Yes, and that is the reason why line or drip must be set using coconut water. How do you use it? Break the coconut water, at least maybe 5 to 10 could fill up a bottle of drip. Now it must be filtered. Yeah, it must be purely filtered. You sieve it and filter it. Yes. Then you cut up the top of the drip From the top, pour in the filtered coconut water. Then you insert drip set. Insert drip set and cannula, just the way it is set in our basic in hospitals. Yes, and that's the reason why I said that such actions must be carried out by a medical expert. We do not use oral administration. So what I mean is that when snake bites individual, we do not need to drink coconut water for it to be effective. If we drink coconut water to treat the venom, it won't work. Before the water starts, being absorbed in the body, the individual must have died. Yes. So that is the reason why we have to use drip pattern. Yes, drip pattern will be done by a medical expert. Although, a lot of medical personnel are not aware about the therapeutic indices of coconut water. Most of them are not aware about the treatment, measure of coconut water treating snake bite, treating venom, neutralizing venom from having effect in our system. Yes, coconut water is a potent snake venom neutralizer. Early last year, individual who was bitten by coconut water was unconscious. Yes, was unconscious, and such person initially went to hospital for drug administration. He was treated, but somehow, as if it was not effectively treated. Then, before I was informed, he was already unconscious, and blood was somehow coming out, droplets of blood were coming out from his mouth and nose. So I have to employ this coconut water using drip pattern. Yes. So I called my nurse to fix the drip. I filtered the coconut water clearly, because anything intravenous, there must not be particles going to the veins, because it could cause what we call an embolus. Yes, and we won't want any embolus to shut down the heart. What I mean, particles, if not well filtered from coconut water, can dislodge within the vasculature, within the veins and the heart, and we could affect the heart. So that is why an expert must administer such drug, because we are using intravenous administrations. When I mean intravenous, we are using vein to administer the coconut water. Could you believe it? That individual, immediately after the administration, he opened his eyes and woke up and was saying, where was he? Yes. But there's one thing about coconut water. It's hypoglycemic in nature. What I mean, it reduces sugar. And as such, using such coconut water for treatment, one should make sure that after the administration of that coconut water, immediately you fix dextrose water, either 5%, most probably preferable 10% dextrose water. What I mean, dextrose water is a type of drip, is the commonest drip people normally take in hospitals. Yes, 10% of it is preferable, because the sugar level of such individual drastically will come down. And when sugar drops in the body, will endanger the individual's life. Yes, sugar has its normal range. So that is why for one to claim to be a food therapist, you must know, you must be medically inclined. You cannot be a nutritionist and you're not having a medical background and you claim to be a food therapist. You're wrong. Yes. So you must have to know disease index, clinical cause, physiological outline of the body system, and the pathological indices of the body system, and the therapeutic measures, side effects, management of different types of diseases. You must have a medical background before you can become a food therapist. And having a medical background, then you now have a background of all types of food and their medical value, the therapeutic indices of all types of foods, how they are being used, and all that. Systematic method of using particular food for particular purposes, and excess use, what it could result to, side effects of those drugs, of certain food that you may use, and all that, whether it's necessary to use it at a particular period or not. So you must have these two basic knowledge before you can become a food therapist. I am a food therapist. I am a disease specialist because I specialize in histopathology, a trained medical scientist, and I have in-depth knowledge of various foods, the medical values, and many more. So that is why I can comfortably say I am a certified food therapist. Food therapy is the new world order. And once we abide by it, it will gradually do away with drug therapy. Yes, because drug therapy has much side effect, greater side effects than food therapy. Before advent of colonization, I believe our forefathers were engrossed with food therapy. But along the line, it was forgotten. Yes, people were strong. People lasted for several years. People could trek several miles and be healthy. But today isn't like that. Yes. Well, I shall be stopping for now to continue later on food therapy. Thank you for listening. Thank you so much.